For today's class, we are continuing our discussion of the primary structures of the digestive system by talking about the stomach and its associated disorders. The stomach is located in the upper part of the abdominal cavity and lies just under the diaphragm. The stomach serves as a pouch that food enters after it has been chewed, swallowed, and passed through the esophagus. The stomach contains contents such as hydrochloric acid and digestive enzymes, and these continue the digestive process that started in the mouth. There are 4 divisions in the stomach. You have the cardia, the fundus, the body, and the pylorus. The cardia is the part of the stomach where the contents of the esophagus empty into. You can see the cardia here in this illustration. The fundus is an enlarged portion to the left of and above the opening of the esophagus into the stomach. Then you have the largest part of the stomach, which is the body being that central part. And then you have the lower portion of the stomach, which is called the pylorus. And this part of the stomach joins with the first part of the small intestine, which is called the duodenum. Contraction of the stomach's muscular walls. The stomach is lined with smooth muscle that mixes the food thoroughly with gastric juice, and it breaks the food down into a semi-solid mixture called chyme. And the definition of chyme is it's a semi-liquid mass of partially digested food that is expelled by the stomach into the first part of the small intestine, which is the duodenum. Gastric juice, which contains hydrochloric acid and enzymes, mixes with food to become chyme. And chyme formation is a continuation of the mechanical digestive process that starts in the mouth. Now remember, the mechanical process of chewing occurs in the mouth, and then chyme formation is another example of a mechanical digestive process. Stomach muscle contractions result in an action called peristalsis. And peristalsis, as you recall, is that wave-like rhythmic contractions that propel food down the digestive tract. Another important structure within the stomach is called rugae. And rugae are wrinkles or folds in the stomach wall that allow for size changes in the stomach. And this is important because it allows the stomach to expand with food. And when the rugae become distended with food, the rugae become ironed out. And again, that allows the stomach to expand. Next, we're going to talk about the 2 sphincters that are found in the stomach. Remember that sphincters are rings of muscle tissue. You have the cardiac sphincter. The cardiac sphincter is the circular muscle that controls the passage of food from the esophagus into the stomach. And then you have the pyloric sphincter. This is the circular muscle that controls the passage of partially digested food from the stomach into the duodenum. The smooth muscle fibers of the sphincter stay contracted most of the time and close off the opening of the pylorus into the small intestine. And to note, the cardiac sphincter is also called the lower esophageal sphincter due to its location at the terminal end of the esophagus and at the beginning of the stomach. And now we're going to look at some different disorders that are associated with the stomach. The first one that we are looking at is called a hiatal hernia. A hiatal hernia is a condition in which the upper part of the stomach bulges or pushes through an opening in the diaphragm. So your diaphragm has a small opening that's called a hiatus, and this is for the esophagus. However, in a hiatal hernia, the stomach pushes through that opening. Now, the most common cause of a hiatal hernia is an increase in pressure in the abdominal cavity. And there are risk factors that can increase the likelihood of developing a hiatal hernia. Hiatal hernias are going to be more common after the age of 50, and individuals who are obese or smoke are also at higher risk. And smoking increases the risk of hiatal hernia because it weakens the muscle of the diaphragm, which makes it more susceptible for the stomach to push through. Treatments for a hiatal hernia include things like eating small meals and avoiding certain foods, not smoking or drinking alcohol, and also weight loss. Now, depending on the size of the hiatal hernia, if it is very large, it may require surgery. The doctors may also provide a prescription for antacids, which help to neutralize stomach acid, or other medications. We'll finish today's class by talking about peptic ulcers. Peptic ulcers are a sore or lesion in the mucosal lining of the stomach. So gastric ulcers are located in the stomach, and duodenal ulcers are located in the duodenum. The primary cause of peptic ulcers is attributed to the bacteria H. pylori. Peptic ulcers can also be the result of long-time uses of non-steroidal anti-inflammatory drugs, such as things like ibuprofen, which is Advil, and naproxen sodium, which is Aleve. There are also contributing factors that can increase the likelihood of developing a peptic ulcer. These include things like smoking, alcohol, stress, and certain drugs, such as abuse of NSAIDs, those non-steroidal anti-inflammatory drugs. The symptoms of a peptic ulcer include burning stomach pain. This may be relieved by eating or taking antacids. The diagnosis of peptic ulcers is either through X-ray or even blood test, and the treatment includes H2 blockers. And H2 blockers are drugs that block the release of histamine. And histamine, it stimulates the stomach to produce hydrochloric acid. And what the H2 blockers do is they're going to reduce the stomach hydrochloric acid production, which can help to treat peptic ulcers. Peptic ulcers can become dangerous because they may lead to bleeding or a perforation, which is a hole, and these can be emergent situations. And that concludes today's lecture on the stomach and its associated disorders.